Trigger finger is a common condition in adults generally, but it might be even more common among military veterans who use their hands a lot during service. In this video, I'll explain what it is, how it develops, and how it's treated. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Trigger finger is a very common hand condition. It can cause a lot of functional impairment. It's a tenosynovitis, an inflammation of the flexor tendon sheaths that basically the tendons of the fingers and the thumb run in, and it results from repetitive overuse. You get a narrowing of the pulley sheaths along with hypertrophy and inflammation of the tendon, and then that tendon sheath gets basically stuck inside the pulley. That inflammation can cause the tendon to become nodular and you get a triggering sensation. Most commonly, it affects the ring finger. Occasionally it's the thumb, but in theory, it can be present in any finger. It involves specific pulley sheaths, and it probably is beyond what I need to talk about in terms of which pulley sheath is most likely. But if you want to know, it's the A1 pulley sheath at what we call the MP joint or the metacarpal phalangeal joint more than the A2 pulley at the proximal interphalangeal joint or the A3 pulley at the distal interphalangeal joint. A patient with a trigger finger typically complains of a locking sensation as the finger basically moves through flex and extension. It can be painful for sure. Sometimes it can be just a dull ache in the palm with movement of the finger. Gradually you get a snapping sound of the flexor tendon as you basically extend and flex the finger. Typically it's on the dominant hand, and again, the most common finger involved is the thumb. Usually it's micro trauma, either through repetitive use or compression forces resulting in inflammation and injury of the flexor tendon and flexor tendon sheath, typically again on the A1 pulley, which is why it's most commonly affected. Inflammation that results in that tendon sticking within the sheath is typically perceived as a locking sensation, and it tends to cause a locking where that tendon gets stuck in the flexor sheath as you go to extend it, and so you'll notice it sort of gets catch. Treatment at least starts as non-surgical. Sometimes that's a steroid injection, anti-inflammatory medications, but a lot of times that either doesn't work or it works, but then it comes back. You can try splinting the finger to see if that helps. A lot of times that doesn't help that much either. Typically, the treatment, once it gets to that point, is surgery, where the surgeon makes a small incision there, releases that tendon sheath, releases that pulley, and then allows freedom of movement. And again, that's typically people that don't get much relief from things like splinting, steroid injections, or that tendon is just stuck and it won't straighten out. Typically, this is a very successful treatment, even in people that have failed treatment and have had steroid injections, and people that have had multiple fingers with trigger fingers. If you have ideas for other topics for these videos for this channel, injuries, risk factors for injuries, the disability claims process, whatever it is, leave those in the comments below this video. Please subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below and you can learn more about working with me and working with my team. We try to make the process simple, we try to make it quick, and I try really hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.